So what happens if PSA is not well treated? So if you leave inflammation of the joints because of due to PSA untreated or even undertreated, so if you're not keen on medicine, you're taking a little bit, you don't want to take too much, but you still have rumbling inflammation, this may actually lead to joint damage. And when you have lots of joint damage, then unfortunately that can lead to disability, which is what we don't want. We want to avoid that at all costs. And when patients have ongoing inflammation, they tend to feel quite tired. They're sometimes anemic. So these are kind of consequences of direct consequences of not treating patients. And here are just some pictures. So thankfully, we don't see this very often anymore. But if you don't treat patients, these are very hot looking, very painful, swollen joints, and also lots of deformities. And you can imagine that the patient will have difficulties even holding chopsticks and cutlery and looking after herself. And thankfully, again, this is we used to see this picture as a medical student. This is a very old slide before we had effective treatment. So this was a young healthy man in 1947 with pain in his spine and inflammation in his spine, and without treatment, unfortunately, they can get a lot of deformities, and you can imagine that his mobility is not going to be great with this bent, stiff back and deformities. And if we don't treat inflammation of the tendons, so going back to, if you remember the first slide I had of the inflammation of the Achilles tendon, if the inflammation goes untreated, sometimes it can actually rupture and tear, in which case you'll need to have an operation. So again, something we're keen to avoid. So inflammation that's grumbling on inside of patients doesn't just affect the joints. It can also cause other problems like accelerated atherosclerosis, which means that there's increased plaque deposition or fatty formation in the arteries of around the heart, or around all vessels, but particularly around the heart and the brain, and that could cause heart attacks and strokes. Patients with PSA tend to are more likely to develop something called metabolic syndrome, which encompasses diabetes, obesity, high cholesterol, high blood pressure, and fatty liver. So this will also need to be treated. And you can imagine when someone has lots of inflammation, feeling tired and painful joints, they're not moving very much. So inactivity, and this can cause bone thinning. So inflammation as well as inactivity can cause bone thinning, and that could lead to osteoporosis long term, making it easier for the bone to fracture in the future. Again, something we're very keen to avoid. Like I mentioned before, there's inflammation. It doesn't just affect the joints, it can also affect the eyes, and it can also affect the bowel. So this is an example of someone's painful red eye due to uveitis, which this patient will obviously need to see an eye doctor quite quickly for treatment for this. And then the patients can also get bowel problems as well, and that's called Crohn's or ulcerative colitis.